it's a big deal. Physicians are burning out at incredibly high rates, and it's not getting better. And they're not getting burned out because their job is too hard. They're getting burned out because of what's called moral injury. Hello again, and welcome to the Larson Hicks YouTube channel. It's good to have you here. I am Larson Hicks, and this is my channel where I rant and rave and talk about whatever it is that I happen to be thinking about at the moment. And today, that is the healthcare industry. I work in the healthcare industry. My full-time job is with a company called Sycamore. Let's see if I can get my shirt in the picture here. Sycamore Independent Physicians. That's our company. And I just got back from a conference, and I spoke with tons of people in the healthcare industry, and so I had this kind of conversation a bunch of times, and so I felt like I'd share it with you here, and that is that I am unabashedly displeased with the state of our healthcare system. I think our healthcare system is in pretty bad shape. And it's evidenced by the existence of most of the vendors at the conference I was at. Most of the vendors, and none of these people are bad people; they're all wonderful people. But the most of the vendors at this conference were in a business called revenue cycle management. A lot of folks in collections and billing, and the thing that you learn when you start kind of digging under the surface is that. This is the only way that physicians can get paid anymore, is if they have this whole administrative army of people to keep up with all the different regulations that come out every 5 minutes around how they bill, what they can bill, how they can collect, who they can collect from, et cetera, et cetera. And just the whole industry of healthcare is about as far from a free market system as I can imagine a system being. And so there's one point I like to make is that it's a false dichotomy to talk about the free market healthcare and socialized medicine as if what we have today is free market. We have something utterly and completely divorced from virtually any and all principles of the free market. We have a system that is completely constricted by regulation. We have removed the buyers, the patients from the decision-making process. The buyers, the patients are not the buyers. The patients, the users of the service, are patients, and the buyers are third-party insurance companies. More than half of which, I think, in the healthcare system today is the government. It's Medicare and Medicaid, and the whole thing is wildly regulated. And then you have these huge companies. I mean, I met with a company this week who's being acquired by United Health, who we all know is a massive insurance company, but they also own Optum, which also owns Sound Physicians. There's a huge physicians, contract management group. So they employ the physicians at thousands of hospitals, have thousands and thousands of providers that work for them. So under the same umbrella, insurance, the payer, the customer, and the physicians are owned also by the same company. Interesting. And then you also have the same group owns hospitals. They've purchased lots of hospitals and hospital systems. And they're also trying to acquire a big billing and practice management company. So they really are, it's like the only person in the whole picture that's not owned by this big corporation is the patient. And that seems interesting. Does not seem anything like a free market exchange of goods and services. So it's it's a big topic. There's a lot to talk about. But I talk about this actually a lot on my podcast that I have with my company Sycamore. It's called Branch Out with Sycamore. I'll put a link below where I talk with physicians about their experience, and I encourage you to check it out, because you don't need to take this from me. You can hear this from the mouths of physicians. Physicians in today's healthcare system are chewed up and spit out, and the reality is that a society doesn't, we can't operate as a first world society without physicians, without medical care. It's just not a luxury. It's a necessity, and it used to be that the whole hospital system, the whole medical system, served to support this sacred work of physicians caring for patients, and that has almost completely been reversed in the last 20 years. So it used to be that the entire healthcare system, the entire hospital, all of the staff, the nurses, the administration, that they all existed to serve and support the work, the sacred work of the physician and his or her calling to heal patients, to care for patients. I've talked about this elsewhere, that the three original professions, the only three original professions were clergy, legal professions, and medical professions. And the idea was that these three types of professions are professing some ultimate truth. And it's a very high calling. It's a very high responsibility. If you lie to people about, or if you're corrupted by profit motive with respect to the law as a lawyer or a judge, then you can completely change somebody's life. They can end up in prison or killed, through capital punishment. If you lie or are motivated by profit as a prophet or a preacher or a clergy member, again, there's eternal consequences at stake, and this is not something we want to happen. And then the same is true in healthcare. That if somebody becomes profit motivated as a physician, they can. We don't want that, because you have this unfair sort of lever. It's life or death, and you can suggest treatments that people don't need because they trust you. You're wearing the white coat, and we know that you've taken the Hippocratic oath to do no harm, and that you view your calling as sacred. The problem is that we've abandoned that whole idea. We've given up on the idea of healthcare being sacred. And we've abandoned the idea that we should remove a profit motive from medicine, but we haven't, but we also we've kept we've kept the Hippocratic oath. So physicians are the only players in this whole thing that have actually promised to do no harm. The pharmaceutical companies, the hospitals, the hospital administration, the CEOs of hospitals, all of the device manufacturers, all of the different service providers that, and everybody in that whole chain, they're all in it to make a living, and they have this fiduciary responsibility to their shareholders to make as much money as they can. That's part of their job. And so you've got this tension, and you've got this physicians who report to and are directly influenced, completely influenced and educated by all of these people. And so they're in a very precarious situation. And if you don't know about physician burnout, you should read into it if you care. It's a big deal. Physicians are burning out at incredibly high rates, and it's not getting better. And they're not getting burned out because their job is too hard. They're getting burned out because of what's called moral injury, which is a term that was coined after Vietnam, and dealing with vets who weren't responding to PTSD treatment. And the common thread was that they not only were traumatized by the things they saw and the things they experienced, but they are also could not get any relief in their conscience for the things that they did, that they felt were wrong, that they were asked to do, that they were expected to do, but they felt were morally wrong. And that's where we're at in healthcare right now. Is we've got physicians who feel like they're being asked constantly to do things that they don't agree with. The other aspect of it is that physicians, instead of being at the top of this whole institution that's supposedly about patient care, they're at the bottom. They take the biggest risk of anybody in the industry. So a CEO, if they get fired, can go find another CEO job or some other job doing sales or whatever. A nurse, anybody in administration, pharmaceutical sales rep, just go on down the line. Everybody in the industry has great job prospects outside of their particular job, but a physician can lose their license for just about anything, and so this is hanging over their head constantly. And we live in this incredibly litigious society that sues like crazy. The Me Too movement has impacted that. There's been a lot of states that have been trying to rein in medical malpractice cases, but like I said, it's not just medical malpractice. It's discrimination and sexual harassment. And look, I'm not saying that those things don't happen and shouldn't be punished when they do, but a physician, loses their license or has their license suspended just for being accused of these things, and that happens in other industries. But most physicians in the country today are hundreds and hundreds and hundreds of thousands of dollars in debt because they felt this calling to be a physician and worked their butts off for a long, long time, put a lot of life on hold, family plans and all of that stuff, so that they could pursue this career. And they, I've heard physicians that have graduate with $700,000 in student loan debt, and the day that they graduate, they have to start paying. They have to start paying it back. And the only way they're going to pay that off in any sort of reasonable time is if they make a ton of money. And that wage is not growing anywhere near the rate of the growth of the cost of healthcare. Physicians, providers in general, their wages are just have become a smaller and smaller percentage of the overall cost of healthcare in America. And so while their wages are just barely keeping up with inflation, if that, administrators, all of these people I've already talked about, they're all becoming a bigger and bigger and bigger piece of the pie. So all of that to say, I could talk about this all day. There's about 25 other things I'd like to say about it, but I would like to encourage people to think about this, because this affects all of us. This isn't like this isn't like other issues. I think this really does affect all of us. We're losing doctors. They're retiring earlier and earlier. The suicide rate amongst doctors in general is higher than the general population. And then I work with emergency medicine physicians, and they have the highest suicide rate of all of the specialties. And this, when your loved one gets in a car accident, you want a board-certified emergency medicine physician who is not struggling with mental health to be waiting at the hospital to take care of you, because it's a matter of minutes and seconds when these life and death procedures are performed and decisions are made, and we have to prioritize that. And so I think you hear a lot of physicians. I hear some physicians talking about, well, we need to unionize, and I just want to, disabuse you of those notions. That's a ridiculously terrible idea. We're in this mess because of the AMA, which was supposed to represent physicians. They led the charge behind getting insurance involved in healthcare, which is all eventually led us to where we are today. That's not the solution. Never has been. Unions do the exact same thing that corporations do. They pursue power. It's the few pursuing power. And so that's not going to be the solution. The solution is going to be building alternative structures, and it's going to take entrepreneurs. It's going to take risk takers. I'd like to give a shout out to some heroes. I actually have a business card here. Let me grab it. These guys, the Surgery Center of Oklahoma. These guys are heroes. I think what they're doing there in Oklahoma is incredible. They started the Free Market Medical Association cash pay surgery. So you go to their website and there's like a picture of a human body with a bunch of dots on it. You can click on one of those dots and get a drop down menu of all the different procedures you can receive, and it's got a dollar amount. It's got the cost down to the dollar, and they don't take any insurance. They just take cash. They do financing, so you can pay as you go. It's wildly cheaper than go price it out. Go ask 5 or 6 hospitals what their price, if they'll give you one, which they probably won't. Their prices will fluctuate wildly. I mean, you can add zeros from one price to another. I mean, you're going to get wild fluctuations. I've seen studies where this has been done for common things like childbirth, and it's just insane. The fluctuation. It's it's all a game. What hospitals charge for procedures. They know that the one thing they know for sure is that insurance isn't going to pay. They're not going to pay what they ask. If they do, that's a rare exception. Generally, they're not going to pay what they ask. They're going to pay a fraction of that. It's going to take a lot of back and forth, a lot of arguing. Arbitration is very common. Lawsuits are now common. That's become a standard thing. I talked to a service provider this week whose whole thing is, what we do for all the unpaid bills from insurance is we bundle them up into a class action lawsuit and we sue to get your money. And it's like, that's the world we live in. These payers just don't pay. We're all paying, by the way. We're all dutifully paying our premiums every month. And again, we're not paying. It's part of our benefits package, so we don't even notice it. But money is going out every single month. Significant money for most of us. It's a significant portion of our income is heading out the door to cover our insurance, which doesn't ultimately want to pay for the procedures. Again, the hospitals inflate the prices because they know they're not going to get what they're asking. It's just a game, and it compounds the need for more and more people to be involved in sorting this out and fighting, and it's a cat and mouse. So these guys in Oklahoma, it's just cash, and if you've got a medical cost sharing type of insurance, that's a great solution. I know probably all of them work with the Surgery Center. A lot of employer funded plans. So you may have a Blue Cross Blue Shield card, but if you work for a really big employer, there's a good chance that they're actually funding their own plan, which means they're making the decisions about who's in network and out of network and what things they pay for and all of that. And so if you do, a lot of those now work with the Surgery Center of Oklahoma, even in New York City and California and all over the country. And they've even become kind of a clearinghouse to where sometimes an employer reaches out to them asking for a procedure, and they end up calling the hospital and saying, "Hey, we'll pay you cash this amount immediately when you perform this procedure for this patient of ours. Do you want the case?" And more often than not, it's like, wait, you're saying I'm going to get paid for sure, and I'm not going to have to argue, and that's the number, that's the real number? Yeah, okay. So it's not like hospitals can't do this. They've got a whole mechanism for cash. If you want to, if you're having trouble finding a specialist, for your grandma who's got neurological problems, and you just can't find a specialist, you can't find one in network, they can't fit you in the schedule, just call and say, hey, what if I was paying cash? Just try and watch. Usually they're going to go, oh, we'll get you in tomorrow. So cash is still king in this country, and you can still get things done with cash. And I think the direct primary care model, the concierge medicine model, this scenario where you're just paying basically subscription cost to a doctor who's committed to caring for 90% of your your health issues from cradle to grave. That's a wonderful solution, I think, for most of us. I think if you have that plus some catastrophic coverage, for if you get in an accident or have cancer or something major, I think if you put those two things together, most Americans are in really great shape and have a much higher quality of care from a provider. So just to, I'm on a soapbox here. I'm sorry. It's hard to stop once I get going. But if you were to be a family practice physician today, graduating with $1 bazillion in debt, you're going to make $200,000 maybe as a family practice doctor. That's kind of the average. And to make $200,000 a year, you're going to need to see about 2,000 patients. You're going to need to have a patient panel of about 2,000 patients. If you do the math, the number of times a year that those people go in for checkups and all of that, the well check. Just if you just math it out, you're looking at a typical family practice doctor seeing easily 30 or 40 patients a day. Just do the math on that. How much time you have to spend with each of those patients if you're seeing 30 or 40 a day. And the paperwork, don't forget the paperwork. There's a mountain of paperwork that physician has to complete on each and every one of those visits. So you're not getting quality care. I mean, I love physicians, and I think 99% of them have wonderful intentions and want to do good, want to help their patients. But come on. I mean, you can't provide the kind of care that most people need. I mean, when you got somebody with a weird chronic issue, there's a reason why most of what happens at a family practice or primary care practice is, test, prescribe. It's just, let's just test your blood. You got high cholesterol. We're sending you home with a prescription for a statin. You're wildly overweight and you're depressed and you're going to kill yourself one way or another. But we're just going to address this with some pills. This is, or sure, your kid's got weird symptoms that keep coming back. We'll just keep throwing antibiotics at it, and I'm sure eventually. Or if it does seem like something's outside of my realm, I'm just going to refer you. We're just going to do this referral thing. Everyone's a specialist. Let's just refer people, and we'll just send you on this wild goose chase, and it's off my, it's out of my hands. That's not what a physician wants to do. That's not what a physician, most who have gone into it, want to actually get to the bottom of things and do the research and help the patient. But you don't have time for that. If you have 30 or 40 patients a day, you just don't have time for that. The system was not built for that. And so, again, a direct primary care doc can make the same $200,000 a year with like 200 to 300 patients. So again, do the math. And by the way, they don't make any more money from you coming into the office and having a visit. So it's actually in their best interest to try to fix you, address your problem as quickly as they can, as effectively as they can. And if that means just driving over to the house, if that means having a phone call or a text chat or an email thread, that's what they're going to do, right? So I do think like those two things to me, or those couple of things, are some really great alternative structures, alternative models, alternative kind of ecosystems. They're not really quite ecosystems yet, but you can see how there's some overlap, where we can kind of tie these things together and create a solution that's going to work for most of us. I just want to see so much more. I just want to see so much more of this. I want to see it all over the country. The Free Market Medical Association, again, that these guys in Oklahoma started, Keith Smith and his partners there, is a wonderful step in the right direction. And I really think that it's time. I think this healthcare system is kind of on its last legs. It's just kind of limping along, and it's going to collapse under the weight of the bureaucracy and the red tape and all of the greedy players that have made this thing into just a a cesspool and a mess. So I say all that as somebody who makes a living in the healthcare industry. My company operates really outside of a lot of the standard stuff. I mean, we operate in basically a cash kind of model where our physicians go and fill in either part-time or sometimes full-time at hospitals that need help, and they're just paid an hourly rate for the work they do. So they're not involved in the insurance side, and neither are we. That obviously is behind the scenes, how the hospital is making money. So it's not completely outside of it. But one thing that we're excited about for our physicians is that they have kind of cut the cord from the corporate machine at some level. They have the autonomy to kind of choose where they work and kind of name the price that they're going to work for. And they usually have several irons in the fire. They have privileges and credentials at several hospitals, so they have the ability to kind of pick up and leave when they want to. If there's a scenario where the hospital's asking them to do something they don't feel comfortable with, or a practice environment that they don't think is safe for themselves or for the patients, they can just say, hey, I'm going to vote with my feet. Peace out. And I think that's a step in the right direction. I think physicians, what's happening is physicians are graduating from residencies with a mountain of debt. They're desperate for security, and they go work for the biggest company because that's the most secure, right? Isn't that's obvious, right? They're huge. They've got really amazing benefits packages. It's probably secure. Well, it's not secure. I mean, and throughout COVID, I think if you were paying attention, a lot of these huge companies had some pretty massive layoffs and canceled a lot of contracts with a lot of doctors. When a company goes bankrupt or a company and just do a little bit of Googling, you're going to find lots of stuff with a lot of these big companies where there's crazy lawsuits, crazy stuff going on. A lot of these companies aren't going to be around in a couple of years because they're going to get shut down because of fraud. They're going to be or they've gotten out ahead of their skis. They've gotten too creative with their financing and debt, and there's a lot of these that are going to just close. And I hope what it's going to leave is a lot of opportunities for a lot of hardworking, virtuous physicians and entrepreneurs to jump in and start taking healthcare back and operating more and more outside of the system, because I think the system's hopelessly lost, and I think it's all fixable. I think it's all fixable. So I've got a lot of optimism about the future of healthcare, but I've also got a lot of cynicism and a lot of skepticism about where it is right now. And I'm happy to have a seat at the table, albeit a very, very small seat, kind of over maybe at the kids' table. But I'm happy to have an opportunity to make a difference and be a part of it. And I think we all have that opportunity just as patients. We have an opportunity to say, hey, I don't like the way this works, and I want to try to do something different, or I want to ask my doctor, hard questions, or try to find better solutions for our healthcare needs as a family. And I will say that, unfortunately, if you're just part of the system, like most of us are, you do need to you need to be your own advocate, and you need to kind of take your health and your family's health into your own hands, because the system is not really set up right now to do a lot of preventative care. And I'll try to stop this recording now, but I'll give one last story. I talked to a physician. Actually, it was a nurse practitioner who was working as a hospitalist during COVID and was observing that the protocols that they got from the government were not working, and that they were killing patients with the way that they were, with the levels that they were using on the vents, and the treatments that they were putting people on, because they were treating COVID like some crazy disease that it wasn't. And it wasn't until, and they'd seen a lot of patients come and die. And it wasn't until one of their colleagues came in sick and exhibiting all the same patterns that all these other patients had, that they finally said, we got to try something different. We just keep killing these patients. Everyone that comes in with this and everyone that we manage this way dies. And they even called their and so they went ahead and said, hey, let's just treat this like a normal respiratory problem, and not follow the government, protocols. And lo and behold, this patient survived. They end up calling, the director of their system and saying, hey, I think we're doing this wrong. And eventually, a few weeks later, the director agreed and changed the protocol. But even then, the protocol nationwide was, somebody comes in COVID positive and they're not dying and they don't need hospitalization, send them home. And don't send them home with, hey, here's the things you can do to manage this and get ahead of this and deal with it and prevent yourself from getting worse. It was just come back when you're about to die, and then we'll put you, then we'll make the big bucks. I hate to say that, but that's kind of the again, that's not how the physicians feel. The physicians are just doing what they're being told by their administration. And their administration is terrified of breaking any rules of innovation. If you want to meet an innovative leader, don't look at hospital CEOs and especially in big systems. That's not where you're going to find them. That's the last thing that's the last question that's asked in an interview of a hospital executive is, are you innovative? That's not what they want. They want a rule follower. They want an enforcer. And it's about painting within the lines. And so anyway, I'll stop this rant now, but it's good to be back on here. I've been traveling for business, and it's just been a busy couple of weeks, so I haven't been on in a minute, but hope to get back on more regularly and record more of these rants and raves. I hope that this has been helpful and interesting. I'd love to hear your thoughts. If you're a physician out there listening to this, tell me where I'm wrong. Help me refine my understanding of how we can make healthcare better. But anyway, I enjoyed being on here and look forward to the next video. Thanks for tuning in. We'll talk to you later.